and welcome to OPENurses Psychedelic Chat. I'm Wendy Marusich, one of the co-founders of OPENurses, and today we have the pleasure of interviewing Kacki Schwartz. So Kacki Schwartz is a registered nurse with 10 years of experience who lives in Denver, Colorado. She started her career as a nurse in the acute care setting, working on orthopedic, medsurg, telemetry, and postpartum units. She continues in her experience as a travel nurse, working across the country as a step-down PCU and surgical trauma nurse. When COVID-19 emerged, Kacki pivoted away from the acute care setting and into the hospice space. She began to explore what it meant to be present at the bedside of dying patients experiencing altered states of consciousness. And it was here where she realized she could show up as a nurse in a different capacity than before. A great unfolding occurred for her, and more opportunities arose to further develop a deeper presence in liminal spaces that birth, death, and psychedelic experience can create. This path eventually led her to starting her role as a dosing session monitor at a local clinical research site in Denver, where she sits in support with patients in psychedelic research trials. More recently, she has created a curriculum for harm reduction education about how to differentiate between physical and psychological emergencies in the psychedelic space. Kacki is a proud member of OPENurses and is excited to be part of the creation of the OPENurses Mountain West chapter. You can find her on Instagram as Nurse Kacki, where she hopes to build a greater community in an effort to uplift the voice and role of nurses in the psychedelic field. It's my great pleasure to welcome Kacki to the Psychedelic Chat. Hey, Kacki.
Hi, Wendy, and hi, everyone that's present with us this evening. Thank you so much for having me.
Yeah, everyone, thanks for joining us. If you are tuning in live, feel free to write in the chat where you're joining from. So great to see you again. For those of you who were at the Psychedelic Science Conference in Denver just in June, Kacki helped run our booth there. She did an amazing job, and thank you so much for that. Yeah. So to get started, let's talk about the trajectory of your nursing career. First, how did you become a nurse, and then how did you get involved with psychedelics?
That's a great question. So back when I was 19, I had a friend who was pregnant and was having a home birth, and she asked me to be her doula. And I said, "What's a doula?" She said, "You're a doula." And so I did some research and was present with her at her home birth. And after that experience, I realized, I think I want to become a nurse. I think I eventually want to become a midwife. And so I pivoted in my college education and got finished up my first degree in exercise physiology, and then went back for my BSN, and really got into nursing through the birth space. Mm-hmm. Started working as a new nurse on a medsurg unit, and ended up being cross-trained to orthopedics and postpartum telemetry, kind of like a float nurse all over. Did that for a few years, and then got the itch to start traveling. Became a travel nurse, worked in progressive care units, and also a surgical trauma unit here in Denver. And then COVID-19 hit, kind of like my bio explained, and my contract was canceled, and it was April 2020. It was a very strange time for myself, and I can imagine very many of us as nurses and other healthcare providers. And I just needed to change. So came back to Denver and found a position working in hospice. Mm-hmm. It really showed me an avenue that I didn't understand at the time, which was working outside of the acute care setting. Mm-hmm. And I really fell in love with it and did that. I started out as a COVID hospice nurse, so I only took care of COVID patients. And it was, definitely was really intense, and it was just an intense time. And it also really opened my eyes to the experience of altered states of consciousness in the dying process, and how important it felt for myself as a nurse and for nurses to be at the bedside in that capacity, which I had experienced in the hospital, but it was very different in the hospice setting. Mm-hmm. And so I did that for several years. And in 2022, I was inspired. I just, again, needed another change.
Mm-hmm.
And I thought to myself, well, if I could do anything with my nursing career, what would I want to do?
Mm-hmm.
And what came to me pretty quickly was I'd like to work in psychedelic research. And so I put in my letter of resignation for my full-time position
Mm-hmm.
to go part-time to kind of give myself some time to figure it out. And then about a week later, I met at a local community meetup group here in Denver. I met the president of the research clinic, and she asked me if I was a nurse, and I said yes. And she said,
Mm-hmm.
would you like to work with us as a LSD dosing session monitor? And I
Wow.
said, yes. So
Yeah,
that's
that was
how it unfolded.
Yeah, that's amazing. So you work with LSD? Yeah.
Mm-hmm. So at the research clinic, we currently work with MindMed, which is LSD compound. We have the Cybin study. We've worked on the Reunion study, which is a psilocybin compound for postpartum depression.
Okay.
We are with the USONA study. We're also with some other studies for buccal DMT film for treatment-resistant depression. Also during that time in 2022, I also entered into the ketamine space as a ketamine infusion nurse around the same time. And that experience really helped me to understand the power of these medicines for people with mental health indications. And so I also have that experience as well in ketamine.
Okay. That's amazing. So tell me a little more about this clinic.
Yeah, so one of the clinics here in Denver, it's called Mountain View Clinical Research, and it's a small team. It's not just psychedelic studies, but also different other pharmaceutical clinical research studies of different medications and indications. But we do have a very robust psychedelic specific study trial cases, mostly with treatment-resistant depression, postpartum depression, and anxiety, generalized anxiety disorder.
Oh, that's great. How many people work at this clinic?
Yeah, so we have the owner operator, and we I think there are five clinical coordinators that are assigned to different different studies. And then it's myself as an RN. We actually have two RNs. It's myself and another RN. And then we have a nurse practitioner. And we also have a licensed clinical social worker who's also a primary dosing session monitor.
Okay.
And then our physicians and primary investigators as well.
Okay. So you're the only nurse there?
So I am one of two. So it's myself as an RN. We have a psychiatric mental health nurse practitioner, and we also have an LCSW who's also a nurse.
Oh, wow.
Who was an LCSW and then went back to school and got her RN.
Oh, what a powerful combination.
Yeah, she's amazing.
And do therapy, right? Yeah.
Totally.
Right. Cool. All right. Well, that's pretty amazing. So tell us a little bit what it's like with the different studies. What do you do as a nurse for these studies?
Yeah, that's a great question. So as an RN, many of these studies, they have different roles for dosing session monitors. So typically there's an assistant dosing session monitor or a secondary dosing session monitor, which is typically an RN. And then they have the primary dosing session monitor. So that would be a PMHNP, an MD, or an LCSW.
Okay.
My role as an RN in these spaces, I mean, other than coming onto these studies, going through the rigorous training, the rigorous clinical training for orientation to the study, how to hold space, orientation to the protocols and the policies and procedures of the study. And there's also, within that is included a lot of role play. So we have, 6 to 8 hour role play sessions where where we are graded on how we show up with difficult patient situations, with lots of feedback. It's a pretty rigorous training, which I'm really grateful for.
Yeah.
I feel like there's a lot of training. There are a lot of options for training out there for psychedelic education. And I think the role play aspect is very important in part of that. And so my role as an assistant dosing session monitor as a nurse is it often looks like taking vital signs in accordance with the study protocols. It looks like taking blood work for pharmacokinetic parts of the study, starting IVs, taking blood work, checking labs, all that kind of stuff. And then apart from that, helping to support the primary dosing session monitor with identifying adverse events or of special interest, adverse events of special interest for data collection for the study. And then, but the vast majority of it, which is my favorite part, is really just holding space and being with the patient, being with them during their experience, helping to manage, because several, if not all of these studies are placebo controlled in their first arm. So there are instances where patients receive placebo or they perceive to have received placebo, and that can lead to a lot of disappointment, especially if people are coming off their medications. It's a big time commitment. They're there for 6 to 8 hours. And so, helping people navigate that and supporting that. And then, because these studies are not therapy driven, so just helping to support people when they're having really big experiences from a non-directive place.
Okay.
And also with certain studies, as an assistant dosing session monitor, I am not part of the integration follow-up, but in some studies, I'm actually also part of the integration follow-up with the primary dosing session monitor with the patient. So I'm there following up with the psychedelic integration piece as well.
That's great. What great diversity of experiences you get within that clinic, and amazing training. Is that training provided by the studies themselves, or is that something that your clinic does? Or
that's a good question. So they are coordinated by the studies themselves. So Fluence is a big one. Numinous, the Numinous trainings are another one. USONA training, which is out of Michigan, I believe. The USONA Institute. So these are all coordinated with the companies that design these trainings.
That's great. So are you seeing results with some of these studies? I know they're still in research and maybe being analyzed and stuff, but what kind of stuff have you seen? Yeah.
We have seen a lot of really positive results, a lot of which are preliminary that I can't necessarily directly speak to. But the phase 2 of the MindMed for generalized anxiety disorder study, when the results came out, we're now in phase 3, but when the results came out, it showed a pretty significant improvement over 12 to 16 weeks with one dose of, it was a dose finding study.
Okay.
So they looked at placebo or 0, 25, 50, 100, or 200 micrograms of their LSD investigational product.
Okay.
And it showed that the 100 milligrams was the most effective.
Okay.
And was showing really very promising results for people with generalized anxiety disorder.
Mm-hmm.
And then of course we have like the kind of personal reports of patients and things like that. The one of the other studies that is coming out with some more data that I'm curious about is the reunion study for postpartum depression, which has it's like a psilocin analog chemical product or medication product that they've completed all of, like, they've gotten all of the as far as I'm aware, have gotten all of the participants that they needed, and are actually, which I learned at the Psychedelic Science Conference and one of the panels with Reunion, is that they're also starting to do studies with pharmacokinetics and breastfeeding. So they're looking at these compounds for lactating women to create access for postpartum women, because one of the exclusionary criteria for this particular study was that they had to be completely weaned off of breastfeeding, which is not doable for everybody. So I think there's a lot of really interesting
issues
to be done.
Right. And then just stop. Right. Yeah. Okay. Yeah, that's a really neat angle on that. Yeah. So and then what about the ketamine work? So that's not research trials, right? The ketamine is people are coming in for that. So are you doing IV? Are you putting the IVs in, or do you sit with them?
So I've worked in a couple different arenas with ketamine, and mostly kind of per diem, part-time, as I balance my hospice work, which I still work in, and also the research clinic. But it's a medicine that I have found to be just so powerful for so many people. I've worked in the mental health indication space with ketamine, as well as chronic pain management with CRPS, or complex regional pain syndrome. They look very different. So with the mental health indications, starting IVs, speaking to the physician, prescribing physician, or prescribing provider about dosage, and getting patients set up, getting the medications drawn up and prepared, and then supporting them in their infusion. And then in the more complex regional pain indications, it's actually a one-on-one continuous monitoring with heart monitoring and routine vital signs every 15 minutes at much higher doses for longer periods of time for the management of chronic pain. So I've kind of worked in both of those spaces, and I think that I would say that I know I often have friends who are nurses ask me, I'm really interested in doing something similar to what you're doing, working with these medicines, working with psychedelics. And they ask, how can I start getting involved? And a lot of what I encourage is, do some education about ketamine. If you sometimes people need that change and a kind of change of pace of things, and I find that working in the ketamine space is something that a lot of people would really like as in nursing.
Yeah. Did you do additional training in ketamine, or were you trained on the job?
I was actually trained on the job by one of my mentors, who's a psychiatrist here in Denver. And I worked in a couple different ketamine clinics, kind of part-time, per diem. And she really taught me a lot. And then I did some additional ketamine training, but not like an official. It was more of like a a course, like a ketamine course, but there's no certificate. There was no certification attached to it.
Okay. Yeah. So you work with all different levels of providers. Right? You work in therapists, doctors, nurse practitioner. But yeah, what kind of unique things do you think nurses bring to the space, or how do you feel your role, compared to others? Like a different perspective that you have, different strengths.
Yeah, that's a really great question. Thanks, Wendy. It reminds me of your poster at the Psychedelic Science Conference that nurses are the Swiss Army knives of psychedelics.
Yeah.
I would say that, man, there's this level of capacity that I feel that nurses bring.
Mm-hmm.
When we walk into a room, we meet a patient for the first time. We're total strangers. But as nurses, we've honed this ability to create a rapport, to create trust, to create comfort and ease in a time where a patient might be experiencing extreme anxiety, pain, discomfort, fear, and because there's a lot of intimacy in between us and our patients that is created very quickly, whether that be physical, touch, providing cares, and also emotional openness that I think in our profession have been honed to,
Right.
which I think is a skill that translates very well to the psychedelic space. I would also say that there's something to be said about the skill of interdisciplinary communication and coordination for patients. As nurses, we are conferring between physicians and therapists, and we are often the kind of go-to person for communication amongst disciplines.
Right.
Which is actually something that I was speaking to about one of the training, like the chief training officers of one of the research companies I met at the Psychedelic Science Conference, and about the role of nurses in the psychedelic trial or the psychedelic research space as educators, because we as nurses can provide education to across these interdisciplinary fields, whether it be discussing with physicians, discussing with therapists, discussing with MAs, whatever it may be. We're able to speak a lot of different languages and make it so that we can relay this education, these instructions, this information to that particular discipline. So I think that's one of many examples of the role of nurses.
Inherent in the nursing training and nursing role, right? Nurses are kind of the nexus point for so many things, right? In a hospital setting, right? The nurse is with the patient all the time and then communicating with all the other services. It's just part of our kind of nursing DNA, I think, to be able to communicate across disciplines, to be able to get things done, right? We're the patient advocate, right? Yeah. So how do you envision nurses kind of in the future of, you're involved with research studies right now. So sort of like the future of psychedelic therapy, psychedelic research. How do you see nurses fitting in?
That's a really great question that I asked a lot at the conference, to a lot of panels and boards about what the role of nursing is in these spaces. And what I really heard in response was that there's an art of presence that nurses are tuned to in these psychedelic spaces. It's like being with patients at the bedside, where how do I put it? It's like we are tuned, and we pay attention to the kind of the subtleness of things, and without necessarily needing to provide any kind of intervention, just being with people. And then, intervening as necessary or providing support as necessary. I also think that the role of nurses in these spaces is by being able to, again, speak a lot of different languages. And again, I'm thinking about your Swiss Army knife diorama. I feel like there are so many roles, both from a clinical strength perspective and also interpersonal relationship perspective, not just with research participants or patients, but also across research teams, and also the way that we connect with CROs or clinical research organizations, pharmaceutical companies, all the different levels of influence and involvement that occurs in a research trial, and being able to speak at all levels to that.
Right. So do you think nurses need advanced degrees to work in this arena?
No, I do not have an advanced degree.
You're doing probably more than most nurses, yeah.
Yeah. I personally do not currently have my advanced degree. However, I feel that it's time. Personally, it's something that I want to pursue, and plan on pursuing next year to start pursuing my nurse practitioner degree. But it's certainly not required. I think it makes it more accessible if a person does have an advanced clinical degree, like an NP. But it's certainly not required.
But yeah, I think some of these clinics, there are maybe more room for RNs actually. Some of these ketamine clinics, like you're not going to hire a to put in the IVs or sit with them. They're going to try to make the NP do other things, right, and prescribe and do other sorts of stuff that pulls them away from the bedside of the actual sitting with the patients. Right?
Correct.
So I feel in certain situations it could be a feature really to be an RN and not be an NP. Having become an NP now, and yeah, we get pigeonholed into doing half-hour appointments and seeing lots of people and billing codes and all this other stuff. So yeah, it's great to see. I celebrate you going on in your education, but it's also amazing to be a nurse.
It really is, and something that I've noticed is a trend, and have heard, in the ketamine clinic space, is that there is a trend of hiring RNs to fill that role, and moving away from like medical assistants or EMT, paramedic, trained providers, more towards the RN, to the RN discipline, which I find interesting, and I think that it speaks to a broader role for nurses in those spaces as RNs.
Right. Well, it's kind of goes back to the Swiss Army knife again, right? Because an RN can actually administer meds, right? Or versus a medical assistant or someone else, right? Okay, so let's see, is there any trainings that you recommend? So we get nurses who are interested in getting involved. They can look around and try to apply to the ketamine space. Perhaps there's other spaces too. So how can a nurse get involved? Where would they look for jobs, or what kind of training do you think they should go get while they're looking for jobs?
Sure, that's a great question. I always found for me, it was really about connecting and networking here in Denver, meeting people, being introduced to providers, building relationships intercollegially, which is how I met both the clinical research, the president of the clinical research site, but she also works in conjunction with the psychiatrist with ketamine clinics. So there was that bridge that was built. And then there's also Indeed. I mean, searching psychedelic nurse, ketamine nurse, research nurse. And granted, here in Denver, I think that there's certainly more of those there are certainly more of those opportunities here than I think other places. But really, I would say get connected with your community. Start with open nurses, and then feel out in your local area, your local community, who's already in this space. I know that here in Colorado, we have, in Southern Wyoming, we also have the NOAC Society, which is a society of psychedelic professionals. A lot of therapists, physicians, social workers, not as many nurses, but I'm seeing more and more of them, but mostly physicians and therapists. So I go to those meetings, network there. And regarding the question regarding ketamine training, I personally learned a lot on the job, but there is one program here in Colorado called PRATI, the Psychedelic Research and Training Institute, and they have a really robust ketamine education program. They offer it, I believe, twice a year. They have one, and then they also have one that's specific to ketamine and the end of life.
Yeah, I've done actually. Did you take that one or
not yet? Yes, they just had one, and I was out of town, but I plan on going to the next one.
Next one, yeah. Yeah, Prati is a great organization. Yeah, if you dig back in our archives, we interviewed Scott Shannon actually.
Oh, great! Yeah,
several years ago, and I also interviewed Chris Pateros, who is she's the nurse who helps, runs the end of life training for Prati, and does their regular training too.
We also have Darren Fisher, who is
a hospice nurse. Yeah.
Yep, another nurse that works in hospice. That's part of the Prati end of life ketamine training. So shout out to Darren, and have been connecting with him, and he's also part of OPENurses. So
yes, we can drop a link in the chat here. Okay. So yeah. Yeah, so we've got Prati. That's pratigroup.org. If you're looking for ketamine trainings, they do a great introductory training. They're very friendly to nurses. They also have the end of life training. So in your bio, you mentioned that you have a harm reduction curriculum. Can you tell us a little more about that, or how that came about, and then what is it, and can people use it?
Yeah, that's a great question. So it came about because I was connected with a local organization here in northern Colorado that was looking for additional education around what the difference is between psychological and physical emergencies in the psychedelic space. And they approached me and said, "Will you teach us?" And I said, "Sure."
Right.
And I compiled a lot. I mean, we talked. It's currently in its first iteration, but it's about 8 hours long, an 8-hour-long curriculum. We split it over 2 days. It started out with the principles of harm reduction, the principles of trauma-informed care. What is it? The common physical and psychological presentations in psychedelic spaces. It also not through me, but as part of this process, they also all received their CPR training. And then we talked about how to navigate difficult psychedelic experiences, no matter what environment we find ourselves in. And then it ended with role plays. So how do we navigate differentiating between what may look like a panic attack versus a cardiovascular event? and how they can overlap in their presentation.
Right.
So there's a lot of that kind of stuff. And again, it's in its first couple, it's in its first iteration, but I've been really grateful to have kind of fleshed it out by providing that education and seeing what was really needed and continuing to refine that and hopefully create a course, like an online course that could either be purchased as a presentation or done as an education seminar in person, to eventually bring this hopefully to the clinical research space, and how to have something that's more excuse me, to have something that is accessible for providers to differentiate and to see like as adverse events for these medicines.
Yeah, that's so important, and I think it's another skill that nurses have, right? And the ability to distinguish those. So what was your audience for who was in this training?
Sure. So it's it's actually a nonprofit group out of Boulder that is they have a cohort of participants where they are following them over the course of a year and providing how would I say, it's like not multidisciplinary, but it's multimodality healing support. So they have it's trauma informed, consent based, somatic, like they're all therapists, somatic, release, dance, ecstatic dance. They have retreats. Like they go on retreats, I think twice a year, to with all the participants to Costa Rica to do deeper work. They have a lot of sexology, kind of sexual liberation support therapies as well. So, and breath work as well. So there are all these modalities that they're bringing together, which all lend themselves to this these altered states of consciousness, accessing deeper liminal experiences. And things can come up for people, in these non-ordinary states of consciousness, including, psychiatric emergencies.
Right. Distinguish that, right? I don't know what kind of emergency you're having, or are you having an emergency at all, right?
Right. Or is an emergency, or and that kind of is another level of it is this an emergency or is this an emergence?
Right.
Of something, and how to hold space with that.
Yeah. I think that's another strength that nurses have. Nurses are trained to be able to like be and not do sometimes, right? Let this unfold for a little bit before we jump in or sound the alarm. True of just across healthcare in general, right? And then in psychedelic space too.
And I think an aspect of that too is really modulating intensity, right? Like, how do we hold our sense of calm, whether in a highly intense situation, whether that be running a code, running a rapid response, navigating in an acute care setting, emergency, or somebody that's having a really difficult psychotic break, and how do we show up with that sense of presence, that sense of peace? How do we help to modulate the intensity of an experience to help support the people around us and ourselves?
Right. So yeah, that kind of leads into my next question. Yeah, what kind of self-care do you practices you have like during and after sessions, right? You're sitting for some of these long sessions, you're holding space where all sorts of things are coming up. So how do you take care of you during this and after?
That's a really great question. and also very, very important.
Mm-hmm.
I feel very fortunate that the team that I work with is extremely supportive of each other. When difficult things arise, we take time, we debrief, we do our own integration, we
Mm-hmm.
call out in ourselves, in community, like amongst each other as friends and as professionals. Like, actually, this really activated me. This brought this thing up for me. To think that we, let me rephrase that. To think that I, as a provider of any kind, am not affected by other people's experience is kind of short-sighted.
Mm-hmm.
So by doing my own work, by being in this work, it helps me do my own work. Whether it be, this comment triggered me or this intensity activated me, um, it helps me to see areas where I can still reflect on my own self. So I think self-care really begins for me in connection with community.
Mm-hmm.
Integration, I journal. I really like to journal, and also have my own personal spiritual practices, and incorporate ritual and ceremony into my day-to-day life in different ways to
Mm-hmm.
um, to help integrate these intense experiences. I
Yeah.
think that the for it helped me to be in hospice before going into psychedelic space, because it was really imperative for me to learn this self-care, and make it a practice, just to take care of myself as I was taking care of dying people, because of the intensity and being
Right.
around grief and suffering and things like that. I
Mm-hmm.
think it really lent itself to the psychedelic space.
Right. So you jumped right in, especially during COVID. I got in.
Mhm.
Right. Um, but yeah, that's a good point about the having experience in hospice work, or some people work with or birth work
Mhm.
too. Um, yeah, there's a different kind of presence and groundedness as a nurse during in those fields sometimes.
I would also say that my experience as a birth doula and being a birth worker, as a nurse as well.
Mm-hmm.
So I haven't. So I worked postpartum on a postpartum unit, but have my career kind of didn't never led me into the labor and delivery space in the hospital, outside of being a not outside of being a doula in those spaces, not as a nurse. So I've
Okay.
been present to many hospital births, but not as a nurse, but as a doula for friends and other clients and things like that. And I think, again, it very similar to the dying process and being with hospice patients, being with birth, both in the home birth setting, the hospital setting, and then also in C-sections. Been present for many C-sections as well as a doula, and not as a nurse. Um, with that hat on, um, again, has taught me how to be and not do.
Mm-hmm.
And how do I increase my capacity for being with that intensity, for being with the the mystery is really what I call it. How do I be with the mystery and not feel compelled to intervene in the process of its unfolding?
Mm-hmm. Right.
And sometimes that's really hard.
That line between right, you're paying close attention but not intervening because right, and using your assessment skills to know maybe is this shifting into something where we do need to intervene. Right.
Yeah, there's a great acronym that I come back to a lot when I'm in these spaces. It's WAIT, WAIT.
Mm-hmm.
It says, why am I talking?
Right.
Or why am I touching?
Right. Oh, I haven't heard the touching part. Yeah.
Yeah, why am I talking? Why am I touching?
Mm-hmm.
And to really connect with that mindfulness in myself of,
Mm-hmm.
this person has started to cry. My response is, well, I want to go comfort them, right? I want to touch them. But what if by doing that or saying something, I want to say, like, oh, I'm right here. But taking a moment, pausing, saying, why do I feel the urge to talk
Mm-hmm.
and say something? Why do I feel the urge to touch them?
Mm-hmm.
even if they've given consent for touch, right?
Yeah.
It might take them out of their process.
Right.
It might just be disruptive to their process. So just slowing down and paying attention and just taking a little bit of extra time for me has really helped me to even further refine that. And again, I think this is, whether it be for birth, death, or the psychedelic experience, that even on the outside, we may perceive somebody to be going through a really painful, challenging, difficult experience, but their internal world is actually, it's beautiful, it's blissful, it's unfolding, so we never know what a person's experience is unless they share it. And sometimes I misperceive it. So that's another thing to keep that I try to keep in mind.
Yeah, some trainings and lectures with Mary Casamana, who was one of the lead therapists for the psilocybin studies for 20 years at Johns Hopkins. She also teaches in the Prati end of life training now. But yeah, you don't know what's going on sometimes, especially when you're working with psilocybin or some of these other medicines, which are more internal, where they're not engaging. You can think someone's going through a really terrible time and you're holding space, just not intervening. And then you find out they were in a blissful experience, but from the outside, you don't know if they're right. What's happening? So to try not to intervene. I had a professor who once had said, when you're was learning how to be in psychiatry, and it was like, when you're prescribing a med, it's like, whose anxiety are you treating? Are you treating the anxiety of the clinician or the anxiety of the patient, right? Or why are you prescribing meds, or, which is the same thing as just an intervention? Why are we intervening? Whose symptom are we treating? So.
Yeah, so that reminds me of something that I learned from a mentor and friend of mine, and I forget where she sourced this from, but I'll have to ask her. But it's this, she calls it the 70-30 rule. And so it's 30% of my attention should be on the patient, and 70% of my attention should be on my response to the patient. Which I think is arbitrary numbers overall, but it helped me to see, okay, actually, like, monitoring my own awareness when I'm in those spaces, holding space for others, is just, if not more important than the attention that I'm giving to their experience.
Right.
And 70-30 might be an arbitrary kind of ratio, but to think that I need to have 100% of my attention on the external experience has led me to miss things, or maybe intervene in ways that might not have been conducive for a patient's experience.
All right. So if anyone's tuning in live right now, if you have any questions for Kacki, you can put those in the chat. Yeah. So
a question that I often get is, as a nurse, how do I get into the psychedelic research space? My suggestion is go on clinicaltrials.gov, look up different research studies, and then under that, there should be there's a list of all of the clinical research trial sites that are currently enrolled for that trial. And if there's one in your area, you can reach out to them and connect with them and ask if they're looking for nurses.
Yeah, that's a great idea. Yeah, it has all the the leads of all the research studies, right? Right at the bottom of each study. That's amazing. Or if you qualify, you can be in the study too. Another way, right?
Totally.
And to get access to these medications, yeah.
Totally. And then you get to be part of, and then you get to be part of advancing the science of it. Which, yeah, there's a lot to that. I'm seeing Ellen's question here.
Yeah, we can pull it up in a second. Yeah, so yeah, Sharon Dopak, who you helped run the table with.
Yes.
She was, and we have an interview with, if people look in the archives. She was in the psilocybin study in an fMRI machine at UCSF. And she contributed herself, literally as a lab rat, into these, to this study to help advance this moving forward. Okay, so we'll take a question from Ellen here. So I think this is referring to your 70-30 rule. Are you suggesting that your internal response to the patient gives you information about what is happening inside the patient?
Oh, that's a really great question. So with the 70-30 rule, I'm speaking more to how I'm, I don't want to use the word dividing or splitting, but how I'm delegating my attention and making sure that I'm really balancing my attention with my own internal process, which is going to happen inevitably as a human in these spaces, tending to that within myself, as well as how attending to the patients, paying attention to the patient's needs. And it really, for me, mostly looks like at this point of, am I hydrated? Am I hungry? Am I tending to, like, am my physical needs being met? Am I comfortable? Did I bring, the energy of the disagreement that I had with my friend into the room? Just like paying attention to that kind of stuff. But there's also, I don't think that my internal response to the patient gives me information about what's happening inside of them, but it helps me to increase my sensitivity to maybe some nonverbal cues, body language things, just kind of the energetic restlessness that might be occurring for a patient, and just tracking it, paying attention to it, and not necessarily having to do anything about it. I hope that answers that question. Yeah.
So we have a little bit more time here. So there's so you're in Colorado where the laws are changing, and now we've got psilocybin, we've got other things coming down the pipe here, right? So psychedelics are all over the news. Everyone's talking about psychedelics now. What are some of the perils you see with this mainstreaming of psychedelics?
Oh, I love this question. My biggest concern about the mainstreaming of psychedelics is the extractive nature that occurs when the extractive nature of colonizing these medicines away from their indigenous roots. And I know that this is part of the OPENurses values, and part of the values of OPENurses is to really speak to and remember the context of a lot of these medicines from the indigenous perspective. That is my biggest concern, my biggest worry, and a conversation that is much larger than the context of what we can do right now. That I feel is important. And I'm seeing Anna's question too about the Mountain West chapter. I'd like to really have more open dialogue amongst all of the members regarding how we see that happening here in Colorado, especially with psilocybin-containing mushrooms, which have been used indigenously for thousands of years across Mexico and different parts of the United States. Again, a much larger conversation, but what happens when we take these medicines out of their indigenous contexts? What happens when we take these medicines and extract them to a singular concentrated compound? What happens when we are taking these medicines out of the context of community, without integration, without support, in a society where the hyper individualism of the self, in my experience, can create a silo? And how much healing can we really do on our own? That's my biggest concern. And I will be glad to share in the OPENurses Facebook group, as well as the Mountain West chapter group, regarding some of the Indigenous leaders that I've been in connection with recently, both here in Colorado and also in Brazil, regarding their concerns, same concerns for the colonization and of this medicine. And so a question that I have for myself is, how do I balance walking in these worlds? How do I balance as a Westernly trained medical professional working in psychedelic clinical research, navigate those spaces and also speak to the concerns that a lot of people have regarding how these medicines and the wisdom of these medicines are being treated.
Right.
Because it's my belief, my deep belief in my relationship with a lot of these medicines is that they are wise and sentient beings of their own right. And I think there's a bigger conversation to be had.
Yeah, there were some amazing talks I went to at the Psychedelic Science Conference where some of these Indigenous leaders, medicine holders, were actually in support of some of this research. They're like, yes, please, respectfully, but go, validate these things we already know, and to help, if this helps get these out there, and, we feel the need to have this, medicalized or scientific framework. But there, two talks I went to, they were really, it was really refreshing. They were like, if you can demonstrate what we've been saying, like, great. So that was a transformation, but how to hold that without, exploitive and extractive practices.
And how do we continue to be in dialogue with eons of wisdom that has already occurred with the same with similar levels of rigor to academic science, right? So it's again, lots of conversation. Chacruna,
right?
Check out Chacruna for more information.
Absolutely, yeah. And then there's other medicines we can use too, right? So you're with LSD or MDMA or ketamine, right? These are sort of modern medicines, right? Without, and like Maria Mangini, she's a nurse. She likes to say that we are the the history of like LSD. She studied LSD. She has a PhD. She studied LSD. She's a nurse. But yeah, she's like, we are the cultural appropriation. We are appropriating ourselves. This is not, we're not stepping on anyone else's anything. Like this is, so.
And I think the same question applies. How are we healing in community with these medicines? With these new, how are we upholding new legacies of these new compounds, which also have their own wisdom and their own sentience,
and learning from the past as well.
Yeah.
So we have a question from Anna, which we were going to touch on. So a lot of us are joining from Colorado, right? So what's happening with, you just are starting the OPENurses Mountain West chapter, and how can people get involved?
Yes, great question. So we had a lot of people sign up at the OPENurses meetup group at the Psychedelic Science Conference. I sent a link to the main OPENurses page for our Mountain West chapter Facebook page. Still in the process of getting infrastructure built and connecting with Andrew and Wendy regarding how do we create collective chapter agreements, and how can we get involved. I started an Instagram and a Facebook group, and just kind of getting things off the ground. I'd like to do some virtual events, and then also schedule hopefully this fall an in-person event, kind of similar to NOAC, the NOAC Society, and they meet once a month in Boulder, once a month in Denver, once a month in Fort Collins, and I believe once a month in Cheyenne, Wyoming. So having some more in-person group networking. And then also something that I think was really cool for me is that I've been able to Like I've had some patients referred to me that are end of life patients and hospice that are interested in pursuing kind of psychedelic experiences in their end of life. And I was able to connect with Darren to say, hey, this patient is on hospice. Do you have any suggestions, resources? So there has already been, like, there's so much potential for,
right.
for connecting with each other and referring people to each other. I don't know, Anna, I know you and I have connected a lot and are connected before, and you have so much to offer too. So I will definitely follow up with you, and we get involved by these conversations, I think.
Mm-hmm. Absolutely.
Mm-hmm.
That's great. Okay, well, we have our traditional final question here. If you could go back and give your younger self a bit of advice, what would it be?
I love this question. Be unafraid. The fear, or I would go back to when I was first a new nurse. In the first couple years I was in a nurse, and I was working in this hospital. I was working night shift. I commuted an hour each way. I felt like I had to put in my time and really prove myself and do all these things to prove that I was capable. And I just put up with a lot. I put up with a lot of things that I shouldn't have had to put up with as a new nurse, because I thought that was the culture, and it was the culture.
Right.
If I could go back, I would say there's so many other opportunities, so many other options. Take the risk, do something different. I like to call myself a multi-passionate generalist. So I'm interested in a lot of different things and how they kind of come together. I'd say don't be afraid. Don't be afraid to take the risk. Life is really precious and really short. And as much as I love being a nurse is also only a part of who I am. And I feel like early on, my identity was like, I'm a nurse. Like, this is my full identity. And as I've gotten older and a little bit more matured and wiser, I think being a nurse is just one aspect of who I am, and learning that. So that's kind of a long-winded way of saying, be courageous, don't doubt myself, and continue to grow in community.
That's great. Yeah. Take some risks, right? Advocate for yourself, right? I think also you're alluding to that, right? Nurses, we advocate for our patients, but you got to advocate for yourself too.
Yeah, advocating for the self in a way that we will continue to have the same culture if we don't change the culture. And that's really what I feel like a lot of the conversations that we had at the Psychedelic conference, which is like, our voices are so important. Voices are so important, and our voices and our choices are so important. And things can be different. I never thought that I could do. I didn't even know that working outside of a hospital was a possibility until like 5 years into my career. I just didn't know.
Right. Yeah, school training for the hospital, right? You do your clinicals in the hospital, right? Yeah.
And there's so many. Nursing is the most diverse. Is really the most diverse possible career. I mean, I've worked as a nurse ear piercer. I got my needle piercing license. Worked as a nurse piercing ears.
Wow.
I've worked as obviously the clinical research. I've worked as a legal nurse consultant, working with lawyers and consulting with them on medical cases. I mean, there's so many options out there. And life is really precious. And another piece of advice is if like, life is short, follow your bliss, don't delay joy. And if you're unhappy in your situation, it's your opportunity to change it.
Right. Excellent. Well, thank you so much for joining us today and sharing your wisdom, and also for now spearheading the Mountain West chapter of OPENurses. And yeah, it's That's great. So thank you so much. And I hope to see other people back on the next month's chat here.
Yeah, thank you so much. It's been really a pleasure and a privilege. And anybody that's listening, feel free to reach out. I'm always open.
So great. Well, everyone have a great rest of your day, whenever you're listening to this. And we'll hope to see you back here soon. Thanks.
Thanks, everybody. Thanks, Wendy.
Mm-hmm.